Welcome to The Fold. My name is Grace Baldwin. I'm going to be your host today as we talk about the collaboration between hospitals and emergency shelters in our community. I'm joined today by Helen Harris from St. Joseph Healthcare, part of the Hospital Shelters Working Group. Welcome to The Fold, Helen.
Thank you, Grace.
Thank you so much for being here with us today.
It's a pleasure to be here.
So can you tell us a little bit about your role at St. Joe's and how you became involved with the working group?
Yeah, thank you. I have had a number of different management roles at St. Joe's over the past, 20 years. But the focus of those roles really has consistently been trying to provide care and navigation of services for individuals who have complex needs. And by complex needs, I mean their needs often cross more than one service sector.
Yep.
People are whole people. So I've certainly had a large focus on individuals who have mental health diagnoses and addictions, but also I serve and have been working with supporting seniors. And I got involved in the Hospital Shelter Working Group back as a member when I was manager in PPL of social work at St. Joe's. And then post-COVID, there was a hiatus that Hospital Shelter Working Group had taken. And there was a call from providers really wanting to bring people back together to collaborate. I then have the honor of being the co-chair, and I have been since that time, and it's been really a great experience.
That's great. And it's been a great experience for me to work closely with you and on the shelter side of things. And
Right.
I think that the work that we're doing together and collaboratively and bridging some of those gaps for people with complex needs, I think is really, really important.
Yeah. Yes. And the need is great.
So can you give us an example about maybe how better coordination would really make a difference for a patient?
Right. That's a really great question. So people who are experiencing homelessness are often the most vulnerable in our community just by the nature of their state at that point in time of being homeless. We also know that points of transition are a time when, so if you're leaving the hospital and going to a shelter or vice versa, it's often a time where information has the opportunity not to get shared accurately. It's a time of vulnerability for people. And so if we can coordinate that and knit together with obviously the person's consent, information shared between the sectors, and then help to understand better the other person's needs and what their environment is, that can really help to support better care.
Absolutely. And I think that's what we're all here to do, right? Is to try to improve pathways for people.
Yes.
Can you talk to us a little bit about what in general does the Hospital Shelter Working Group do?
Yeah, great. So we really have broken it down actually into a work plan that's generic. We always are talking about communication, and that may additionally include emerging trends, concerns that people have in terms of what they're seeing on the front lines, and then collaboration. Also trying to then see about, are there services that we might bring into the Hospital Shelter Working Group for presentation, for information sharing, advocacy. We know we're in a time of significant ongoing, I say unrelenting emergency with respect to homelessness, our mental health and opioid crisis. And so by coming together, and if we see that there really is a significant need, now that we have changed our structure, so we're reporting to the GIN Mental Health and Addiction Secretariat, we have a way to reach senior leaders and really advocate in a way that the working group really can't. But that really helps us to be a voice and to have a formal structure. We also are trying to create, as you said, capacity in the system. So both pathways to care. So people have come as a whole person. And we're seeing older adults now who are experiencing homelessness, and they may have medical complexities, physical care complexities, mental health complexities, etc. So if we can share information and build capacity so shelter staff know how they might best interact, how they can get supports around harm reduction, etc., that's the best way that we can come together.
That's a lot of really amazing work. And Good Shepherd takes part in the Hospital Shelters Working Group. Lots of our emergency shelter team members are there. My team are part of the group. Yeah. Who else is a part of the group and is contributing to the work we're doing together?
Right. Great question. So we have, I'm going to put this in two parts. First of all, we've had open membership, and that has been since it formed, I believe, in 2003. Which is a long time for a working group to be existing. And I think kudos to everybody around the table who's passionate about improving the care and supports that we offer for people experiencing homelessness. We have always had that open membership. We have frontline staff as well as managers, directors. So it's really a mix, which I think is part of the beauty of it, because then we really get to hear that frontline perspective as well as then taking what we might hear and seeing if there's something we might do about it. We have, yes, our wonderful Good Shepherd partners, Salvation Army, Mission Services, CMHA, the City of Hamilton, the Hub, Social Navigation Program, of course, St. Joe's, HHS, so both hospital organizations, YWCA, YMCA, St. Matthew's House Wesley Services, and I'm probably missing some folks, but that's who overall we've got representation from.
That's amazing. And as you say, like a mix of direct service employees and people who are directly working with clients, a mix of management and senior leadership, and all of those voices coming together and leading some change.
And can I just add, because I'm forgetting, really great partner, and of course this is kind of knits us all together in a way now, is our GHIN partners, Greater Hamilton Health Network. So they've been a great support as well.
Absolutely. Yeah. And being able to share updates to the Mental Health and Addiction Secretariat and talking about some of the things that are coming up in our working group and what people are sharing about what they're seeing and the impact that some of the work is having. I think that's great to have that feedback loop. Yeah. Lots of good support. How do you think information sharing can improve care transitions for individuals who are maybe unhoused or staying in shelters?
Right. Yeah, that's a great question. And I'm going to answer it on both ends. So let's say I'm a person in hospital, I'm homeless, and I'm now going to a shelter. Obviously, we need consent. We get consent. And then we can, if we secure a shelter bed for an individual, ensure that we share information about follow-up appointments. Often there is follow-up after hospitalization, which is critical for someone's health outcomes. We can share prescriptions, information to help support that person so that when someone goes to shelter, I'm experiencing homelessness, we just understand that if I'm experiencing homelessness and maybe I don't have a cell phone, I'm living in poverty, I'm worried about how I'm going to secure housing, how I'm going to secure safety and all of the necessities of life. Having that support around you for somebody who can help to make sure that you remember your appointments can really help that follow-up care, because we don't want people to have to come back to hospital, not because of the access issues, although that would be part of it, but 100% because it means then that you're getting ill again. From the other end, what we see are individuals who are sent by shelter for really good reason. You know, Helen is, say, acting different. She seems odd. There's, maybe my level of consciousness is coming in and out. So I am then sent to shelter, from shelter to hospital. And by the time I get seen because of the wait, etc., right? Maybe paramedics were needed to give me some medication to help, me be more calm. By the time I see the physician who's going to ask, unless there's something obviously wrong with me, what brings you to hospital today? Because they sent me is, at this point, I'm wanting to leave. Thank you very much. It's been a really long time. I may want to go for a smoke. I may, whatever it is. And that then leads to the underlying causes or what really the shelter had wanted addressed not being very well addressed. So if we can both send information, receive information from both sides, then that person is much better supported.
That's great. And promoting mutual understanding, right, of what everybody's role is in caring for vulnerable people.
Absolutely. Yeah. Absolutely.
So Helen, can you tell me a little bit about how you think this partnership between hospitals and shelters helps improve overall well-being in our community?
Yeah, thank you. I think it's really significant in that we want to have individuals who are most vulnerable in our community cared for with compassion, cared for and have their needs met. So if we can help ensure that people aren't going back and forth, it also then provides access to care by people not needing to come to hospital repeatedly because their needs are not being met. And so that's additionally, I would say that people in shelter are wanting to provide the best supports. Staff are wanting to provide the best supports. So if we can coordinate and have that communication, we're hoping people are able to secure their space in shelter and remain there until that they move to the next stage and are able to get back on their feet and get housing.
That's great. Yeah, because I think if people's health needs are met while they're staying in shelter, then we can do the work that the shelters need to do, right? To focus on long-term housing goals and getting people where they need to go and helping them achieve everything that they desire for themselves.
Absolutely.
Because shelters are not healthcare providers, I think, many shelters have health services embedded in the work that they do, but being able to partner and work with healthcare providers, I think enhances also what us as emergency shelters are able to do and the continuity of care for people who are, moving between hospital and shelter will improve.
Absolutely.
Yeah.
Absolutely.
And Helen, would you be able to talk about how you think that our collective work in the Hospital Shelters Working Group reduces strain on emergency shelters and other services?
Right. It's so absolutely, and I think all over. So with the shelters, if we can understand better what a shelter environment is, that maybe this shelter doesn't have accessible spaces, then from us as hospital staff can make sure that we're sending appropriate referrals. And then additionally, that we know then what support somebody might need to have in place so that when they're ready to be discharged, and if they don't have housing and we can't find that for them, then they can go safely and that continuity of care is built. I touched on with respect to access to care in the emergency. And of course, underlying that is the best care and health for that person. And by that, I mean holistic. We really want to be able to meet the person who's experiencing homelessness, all their needs in a way that they wish, so they're stable.
Exactly. I think giving agency and voice also to the individual,
Yeah.
And making sure that they feel that their voice is heard, and that communication between the hospital and the shelter ensures that, messaging is consistent, follow-up appointments can be made, referrals can be followed up on. And I think this is really amazing collaboration that's happening in our community. And I'm so proud to be a small part of it, as I'm sure I know you are as well. Helen, you've talked about your long experience with this working group. I'm sure there's been moments that have really reminded you about, why you're doing this and why this is important. Can you share some of those examples?
Yeah. I think the one that stands out the most for me is actually from a time of significant concern by everybody at the shelter working group last year, early December, when we were concerned that there wasn't enough warming spaces for folks to go to who were experiencing homelessness. And we just know that in our Ontario winters, really it's year round, but particularly in winter because of our climate, really concerned that folks would experience real harm. And so we had just formalized as a group through a unanimous decision that we were going to change our loose structure a little bit more formalized so that we reported up to the Mental Health and Addiction Secretariat. So a lot of concern expressed that meeting in early December 2024, went then to our Mental Health and Addiction Secretariat and leadership. Within a week, we had the hub funded by the GIN, HHS, and St. Joe's. And that really relieved a lot of pressure and moral distress that staff feel in the hospital. I'm sure in the shelter, when shelter staff are needing to turn someone away because they just don't have more space. So being able to offer that consistently through the winter months really was a moment where I really thought this is what really needs to happen.
How powerful. Everybody coming together, identifying a need and coming up collectively with a solution.
Yeah.
And that solution allowed hospitals to transition somebody who was unhoused into a space that was supported by staff and volunteers, overseen by the hub, instead of worrying about discharging anyone to the street or not having available shelter beds during our really cold months. And overall, that was a really, really huge success last year, wasn't it?
It was.
Yeah.
It was. And we were able to continue it this year.
Amazing.
Which at a different location, because wouldn't you know it, the space that the hub was in was sold. So yeah, space is an issue. But really, it's the people around the table, the people that we serve who have the resilience to, have their needs met, to come forward, receive care, that really gives me hope.
Yeah, that's a really great example of what we can accomplish when we work together, I think, as a community. What gives you hope? You've mentioned hope. What gives you hope about the direction that this work is heading?
Yeah. What gives me hope in a time where I have to say I worry. I worry about the state of our ongoing emergency in Hamilton, in Ontario, in Canada, and really internationally with respect to the lack of housing and affordable supported housing. What gives me hope is that with that, while folks are feeling the stretch and really busy, people continue to come and want to learn and strive to do better. The amazing care and support that is offered for people who are experiencing homelessness and partnership with them, as you said, to help them realize where they want to go. When you're experiencing homelessness and don't have a place that's safe to go, that's, when I'm not speaking as a person who has experienced homelessness, I do know some of our support services that we've put in place now, peer support services, are really helpful in connecting people who often in hospital, who often don't feel that their needs are being listened to. So we have further to go. And I also am, I'm going to say, as St. Joe's staff, encouraged by the focus on serving the needs of individuals who are coming to our hospital. And of course they are. We know when you're experiencing homelessness, trauma, wounds, there's exposure to the elements. There's so many reasons why you may need more frequent hospitalizations or care that you just aren't necessarily able to get in what we could consider the standard way. Although our shelter health network partners are wonderful and do wonderful work. The last thing I'll say about hope, again, and it gets back to the people around the table and the wonderful partners that we have, and we want to be part of that. And I want to be part of that. I really want to try in my role to make a difference.
That's amazing, Helen. And I think you are accomplishing just that through your work in this working group. And I think even when there are so many demands on people's time in this day and age, and, we're responding to a housing crisis in our community, the opioid epidemic, all of these things that you just mentioned, having a committed group of partners to come together on a monthly basis, we don't always have the solutions, but we're talking about the issues and we're working together to find those solutions under your leadership. And so I think it's a privilege to partner with you in that work. And thank you for coming today on the podcast to talk about the working group.
Oh, well, thank you so much. And it's just been delightful. You've been such a wonderful co-chair. And Good Shepherd's such a wonderful partner. So thank you.
And thank you as well.